You know, colon cancer is often called the silent killer because it might not show any symptoms until it's already causing trouble. Today, we've got a really important topic on our hands: 10 early warning signs of colon cancer you should not ignore. In fact, over 100,000 new cases of colon cancer are reported each year in the US, making it the third most common cancer in both men and women, with almost 50,000 deaths annually. So, it's vital to know the early warning signs to catch it early. Remember that everything you hear in this video is unbiased, fact-checked, and reviewed by qualified health professionals. Before we dive into the warning signs of colon cancer, let's take a moment to understand what colon cancer actually is. Don't worry, I'll keep it simple and easy to follow. The colon, also known as the large intestine, is a crucial part of our digestive system. Its primary job is to absorb water and nutrients from the food we eat while getting rid of waste in the form of stool. And here's where things can go wrong. Sometimes, the cells in the colon can start acting up, becoming abnormal and multiplying uncontrollably. When this happens, it leads to the development of tumors or growths, and that's what we call colon cancer. You see, the human body is incredibly complex, and sometimes, our cells can become damaged or behave strangely. If colon cancer is left untreated or undetected, the cancerous cells can spread to other nearby organs or even travel to distant parts of the body through the bloodstream or lymphatic system. That's why catching colon cancer early is so crucial. It gives us a better chance to fight it. Remember, I'm not a physician, but I'm here to share vital information with you. If you suspect anything or notice any of the warning signs we're going to discuss, it's essential to reach out to a qualified healthcare professional. They can perform the necessary tests, like colonoscopies, to diagnose and treat colon cancer early. Alright, now that we have a better understanding of what colon cancer is, let's move on to the early warning signs you should never ignore. Remember, knowledge is power when it comes to your health, so stay informed and take care of yourself. Alright, let's get into it. Sign 1. Blood in your stool. Okay, let's get serious for a moment. Finding blood in your stool can be a red flag for colon cancer. Of course, it could be caused by other stuff too, like ulcers, hemorrhoids, or infections, but it's always better to be safe than sorry. Don't brush it off. Get it checked out. Sign 2. Bleeding from the rectum. Alright, now we're talking about bleeding from the back door, which can be pretty scary. But hold on, before you start panicking, know that this symptom could be caused by other things like hemorrhoids or anal fissures. Still, it's essential to rule out any serious issues, so don't hesitate to see your doctor if you're experiencing this. Sign 3. Unexplained bloating or abdominal pain. Bloating. It's the most annoying feeling ever, isn't it? But sometimes, it can be a sign of colon cancer, along with abdominal pain. Now, take your time. It could be related to other factors too, but if it keeps bothering you, it's better to get it checked out. Sign 4. Feeling constantly tired. Hey, do you ever feel like you're tired all the time? I get it. Life can be exhausting, but if you notice you're feeling more tired than usual and it's not improving with enough rest, it might be a sign that something's not right, especially if you have other symptoms like bloating or abdominal pain. You might want to talk to your doctor. Sign 5. Sudden weight loss. Losing weight unexpectedly can be quite alarming, and it could be an early sign of colon cancer, among other things. But don't jump to conclusions. Sometimes, it's just your body adjusting to something new. But if you've lost more than 10 to 15 pounds over a few months without trying, it's worth mentioning to your healthcare provider. Sign 6. Feeling full all the time. Ever feel like you're full even when you haven't eaten much? Yo, that can happen. But sometimes, it might be a sign of a digestive tract issue, and yes, that includes colon cancer. Now, don't get all stressed out about it. It could be due to other stuff too. But if you have this symptom along with unexplained weight loss or fatigue, it's time to talk to your doctor. Sign 7. Unexplained anemia. Anemia is a condition where your body lacks enough healthy, red blood cells to carry oxygen to your tissues. In some cases of colon cancer, the tumor may cause chronic bleeding, which can lead to iron deficiency anemia. If you're feeling constantly fatigued, weak, or dizzy, along with other signs like pale skin, it's essential to get your blood checked for anemia. Sign 8. Persistent nausea or vomiting. Feeling constantly nauseous or experiencing unexplained vomiting can be unsettling. While these symptoms can be related to many conditions, colon cancer might be one of them. If you can't find a clear cause for your persistent nausea or vomiting, don't hesitate to consult a healthcare professional. Sign 9. Family history and ethnicity. Alright, let's wrap this up. When it comes to colon cancer, your family history and ethnicity can play a role in your risk. If you have a first-degree relative who had colorectal cancer before age 55, your risk might be higher. And African Americans tend to have a high risk compared to other races. But remember, this doesn't mean it's a done deal. A healthy lifestyle and early detection can make a huge difference. That was a lot of info, but I hope you found it helpful. If you did, show us some love by hitting that like button, and if you haven't already, why not subscribe to our channel? Practical health tips. We've got more informative videos coming your way, and you don't want to miss out. Alright, take care of yourselves, and remember, early detection can be a game changer. Thanks for watching, and see you next time.